Hello guys, today I want to tell you about different types of infections. So I want to start with viral infection. Viral infection, this is viruses are very tiny infections organisms. They are even smaller than bacterials. On the most basic level, a virus is composed of a piece of genetic material that is surrounded by the protein shell, and some viruses may have an additional envelope for the features on their surface. And viruses are parasitic. They are parasitic and they require a host cell in which to carry out their life cycle. Once the virus has entered the host cell, it's able to use cellular components to reproduce. New viruses are released from the host cell, and a process that all that all sometimes causes the host cell to die. Some examples of viruses infections, they include influenza, that is the flu, common cold, measles, we have rubella, chickenpox, we have norovirus, we have polio, we have infectious monococcus, we have, in short, we call it mono. We have infectious mononucleosis, we have we have herpes simplex virus, that is HSV, we have human papilloma virus, we have human immunodeficiency virus, that is HIV. We have viral hepatitis, which can include hepatitis A, B, C, D, and E. We also have viral meningitis, we have West Nile viruses, we have rabies, and we have Ebola. And the most recent one, we have COVID-19. And possible treatment. Most of the time, the treatment of viral infection centers on, rel- on relieving symptoms until your immune system clears the infection. So most of the time, the treatment of viral infection centers on relieving symptoms until your immune system cell clears the infection. In some cases, antiviral drugs may be available to help to treat the viral infection. Some examples of viral infection for which antiviruses are available include HIV, herpes, and hepatitis C. Some viruses stay with you for life once you have been infected. They can lie dormant within your body and may reactivate. Some examples, they include the herpes simplex virus, that is HSV, and we have varicella zoster virus, VZV. VZV. So something you're supposed to note here is it is important to remember that antibiotics aren't effective in treating viral infection. So we have gone to another type of infection, which is fungal infection. Fungi Fungi are another diverse group of organisms that can include things like yeast and molds. They can be found throughout the environment, including the soil, indoors, in most areas like bathrooms, and and on or in our bodies. Sorry. Some fungi are so small that you can't see them with the naked eye. Other times, you are able to see them, such as when you notice mold on your bathroom tile. That's when you may see them. Not all fungi can make you ill, but some examples of fungi infections, they include vaginal yeast infection, we have ringworm, we have athlete's feet, we have thrush, we have how do we call this, fungal meningitis, we have Streptococcus infection and histoplasmosis, and as aspergillosis. I think that's how it is. It goes. I've forgotten it, but that's how it is. And the possible treatment for these fungal infections are fungal infection. They can be treated with antifungal medications. The type of medication that you are prescribed will depend on the type of fungal infection you have. For example, A topical antifungal cream may be prescribed for conditions like ringworm or athlete's feet. Or oral antifungal medication are also available. More severe fungal infection may require intravenous intravenous 5 antifungal medications. So we want to go to another type of infection, and this one is parasitic infections. Parasites live in or on a host organism and get food or other nutrients at the host expense. There are three types of parasites that can cause illness in humans. We have protozoa, they are small and one-celled organisms. We have helminths, they are large and worm-like organisms. And we have ectoparasites, organisms such as fleas, ticks, and lice. Some examples of infections that can be caused by parasites, they include, we have malaria, we have toxoplasmosis, we have trichomoniasis, we have cardiasis, tapeworm infection, we have roundworm infection, we have pubic and head lice, we have scabies, we have leishmaniasis, and finally we have blindness. River blindness. Possible treatment for this parasitic infection, as with sorry, as with bacterial or and fungal infection, there are specific drugs available to treat a parasite infection. The type of antiparasitic medication that you need to take will depend on the type of parasite that is causing your infections. And symptoms for this infection. The symptoms of an infection can vary depending on the type of infection that you have. Some general symptoms that can be indicated you may have an infection include fever or chills, body aches and pains, feeling tired or fatigue, and then we have cough and sneeze. Sorry, we have digestive upset such as nausea, vomiting, or diarrhea. There are some situations that should always trigger a visit to your doctor. See a doctor if you have symptoms that worsen or don't improve with at home care, and symptoms that are prolonged or recur, and difficulty breathing, severe headache that occurs with a high fever, a rash, unexplained swelling, and a bite from an animal. It is also possible for you to have an infection without having any symptoms. Some examples of this infection that don't always cause symptoms, they include HPV, gonorrhea, and chlamydia. Causes of infections transmission. You can get an infection in many different ways. We have direct contact. Some, but not all, infections can spread when you come direct into contact with the person who has an infection, whether through touching, kissing, or having sex. Direct contact with the body fluid of a person who has an infection can also spread infection in someone in intenses. This can include things like blood, nasal secretion, saliva, semen, and vaginal secretions. Lastly, sorry. Lastly, some infections can be spread directly from an infected mother or to her child, either through the placenta or during childbirth. In direct contact, some infectious organisms can be found throughout your environment. You can come into contact with these things and then spread the infection to yourself. A common example of this is when someone with the flu coughs or sneezes. Influenza virus can be present in the air or an object such as door and the faucet handle. If you touch a contaminated object and then touch your face, mouth, or nose, you may become infected. through contaminated food or water. In some cases, food or water may be contaminated with infectious organisms. You can get this infectious by consuming things like food prepared or prepared in unsanitary conditions. We have raw or undercooked foods such as produced meats or seafoods. We have improperly canned foods, and unpasteurized milk or juices. Also, foods that have been improperly stored or refrigerated. From an infected animal, some infections are spread by people from an infected animal. An example is the rabies virus, which you can get it if an infected animal bites you. Another example of toxoplasmosis, you can come down with this parasite disease from changing an infected cat's litter box. From a bug bite, there are many different types of biting bugs, include ticks, mosquitoes, and lice. In some cases, you can get an infection in a bug carrying around an infectious microorganism they bite you. Some examples they include malaria, Lyme disease, and West Nile virus. Not all infections are spread in the same way. While one infection may be transmitted via infected blood, another may be transmitted by a bite of an insect. It's always important to consider the specific infection when talking about transmission. So identifying an infection, some infections have very characteristic symptoms. They vary, that is. Your doctor may be able to make a diagnosis based off to these symptoms, your medical history, and physical examination. In other cases, it can be hard to determine what type of organism may be causing your condition. For example, some bacterial and viral infection can have very similar symptoms. In cases where it is unclear what's causing your infection, your doctor may take a sample from your body to be tested in a laboratory, where this simple sample is collected from depends on your illness and type of organism suspected. Some sample types can include blood, urine, stool, nasal or throat, sputum, and, and cerebrospinal fluid. Your doctor may also use imaging tests such as an X-ray, CT scan, or MRI scan. In some cases, they may also want to take a biopsy of the affected tissue to examine it. Preventing infections. So here there are many actions that you can take to prevent the spread of infections. Be sure to follow the tips that I'm going to give you. 1. Practice good hand hygiene. Wash your hands often, especially before eating or handling food, after using the toilet, and before touching your face or mouth. Another thing, get vaccinated. Many infections can be prevented through vaccines. Examples of this will include, but are limited to, measles, whooping cough, and hepatitis B. Another thing, avoid sharing personal items. These include drinking glasses, toothbrush, and razor blades. And practice safe sex. Also, cover cuts or scrubs. This can lessen like we make them lessen the chances that they'll become infected. Don't pick or scratch them. Use insect repellents or sprays. These products can help you to avoid being bitten by mosquitoes or ticks. Be careful with food. Always prepare food in sanitary conditions and make sure it's heated to the proper temperature before eating. Avoid wild animals. Make sure to have any animal bites examined by a doctor. And know before you go. If you are traveling, be aware of any infections common to the area where you will be staying. Some of them may even have vaccines available. Cover your mouth when you cough. If you are sick, be sure to dispose of all used tissues properly. If you don't have tissues, cough into the crook of your elbow instead of your hand. Stay home if you are sick. This can prevent you from spreading an infection, and make sure to ask your doctor when you can return to work or school. So, I've talked about viral infections. I've given examples of the viral infections. I've told you about possible treatments. I've told you about fungal infections. We have talked about the examples of these fungal infections. I've also talked about possible treatments, parasitic infections, examples of these parasitic infections, possible treatments, symptoms of infections. We have talked about causes of infection treatment, direct contact, and also we have talked about from an infected animal, from bug bite, from identifying. So we have also talked about identifying an infection. And finally, that's all about what we have talked in these infections and examples of these infections. Let me talk about notification of infectious diseases. Sorry. There are some internationally notifiable diseases. World Health Organization member states report on plague, cholera, and yellow fever. Moreover, every country has its own list of notifiable diseases. The major problems related to these sources, that is, health service records, are low compliance and delays in reporting. Health surveys Health surveys are studies conducted in a representative sample population of option more comprehensive data for monitoring and health status of a population. There are two types of health surveys. Surveys are survey of specific disease. These are studies conducted on each specific disease. For example, we have HIV/AIDS, trachoma, tuberculosis or leprosy, and diarrhea diseases. Survey of general health status. These are studies on general health status of the population. They are based on interview, physical examination, and laboratory tests. They are expensive. The advantages of survey based on interview, they are more representative of the health condition of the community. The demonstration is the denominator is known. Data are more uniform and in quality. And when we talk about limitations, data accuracy depends on the memory and cooperation of the interviewee. Surveys are expensive. Methods of data collection. The main method of collecting information, they are observation. We have interview and questionnaires. We have documentary sources. Yeah, and when we talk about documentary sources, clinical records and other personal records, death certificate and publications, those and other more. That's all about today. I'm kindly requesting, please just like, comment, and subscribe to my channel. And also, most important, share this to people so that they can get this information. Thank you and be blessed abundantly.